Well, where does Wisconsin rank in terms of the healthiest states in the country?
A new report shows Wisconsinites are living longer, but not necessarily better. The Wisconsin Health Trends Progress Report is the first comprehensive look at trends in the state's health indicators over the past 10 years.
Karen Timberlake from the Wisconsin Population Health Institute is with us tonight. Welcome to Live at 5.
Thank you. Good to be here.
So what did you look at in this report?
Well, we really wanted to take a comprehensive look at both the question of are we living longer in Wisconsin, but also are we living better and healthier? You know, that's what any of us would want for ourselves and our family members. And so we looked at indicators of things like premature death, so death before age 75. We also looked at the old reliables, smoking, obesity, excessive drinking, but then we looked at some things that you might not associate with health, like high school graduation rates and unemployment and child poverty. And all of that gives us this comprehensive picture both of how healthy are we today and what might we expect in the future as far as trends in health.
And what'd you find?
What we found is that overall, people in Wisconsin are living longer, but we're not necessarily living better. And what we mean by that is when we look at things like self-reported health. So if we called you and asked you, is your health excellent, good, very good, etc., more people in Wisconsin are saying that their health is only fair or poor. And that turns out to be actually a very strong predictor of, if we looked at their medical records, how healthy they actually are. So that's of concern to us. Also of concern are things like our smoking rate in Wisconsin has been going down for many years. We know that's important. Smoking's tied to so many diseases, and yet it started to tick back up. So when you look at the data over a 10-year period, you can see both that, well, we were on the right path, and now how do we understand this recent uptick, and we better watch that. It might mean that we need some new strategies.
So we're living longer because of better medication, better technology, those kinds of things?
So I think that's one of the great questions that this report asks, but we don't yet have the answer to. And so we hope that people across the state will ask themselves that very question. I think one thing we could say is that it could be that all of our advances in healthcare really have enabled us to prolong life. But we don't just want a long life, we want a healthy life. And health is related to what happens in a doctor's office, but it's also related to where we live, where we go to school, where we work, how we spend our leisure time, and that's part of what we can see in these trends.
And where do we rank nationally with other healthy states?
Yep, so one of the best measures of that is a set of reports done by the United Healthcare Foundation. And in its most recent snapshot, Wisconsin was 13th among the 50 states in terms of overall health. So, you know, depending on where you look or how you look at that, that's either pretty good or
pretty average.
What's up with those 12 states that are ahead of us.
So is this a call to action then, perhaps?
Well, that's part of what we hope through this report. You know, we know there are so many things that influence health, and by beginning to paint a picture of how are we doing over time, we at the Population Health Institute hope that we can help the state pick priorities, and not just the state, but how about local communities? You know, we know that health is local. We know that much of health improvement happens locally in schools, in chambers of commerce, at United Way tables, etc. So if we have to pick some priorities, this is one set of resources to help people start.
Great place to start.
Very interesting.
That is. Karen, thanks for being with us today.
Thank you.
Good to see you. Thanks, Karen.